Open enrollment for the 2018 healthcare exchange begins tomorrow.
You will still need to have a health insurance plan or face a penalty, but this year the enrollment period will be a little different. News 8's Madeline O'Neill has more.
I think there's a lot more confusion.
Wanda Palmer is one of 2 healthcare navigators at Workforce Connections in La Crosse.
And some people, if you've been watching the news, think that because they were debating or doing so much with repeal and replace, that maybe it had gone away.
But the marketplace is still here. Palmer joined U.S. Representative Ron Kind in La Crosse Tuesday to pass along that message.
But I'm really worried about it because of all the chaos and confusion. When people get confused or they're not certain, they tend to freeze up and they don't take action. And that's what we're asking them to do.
This year, the enrollment period for healthcare is shorter, lasting from November 1st to December 15th.
That's right.
And Kind says he wouldn't count on the administration extending that deadline.
Either you're in or you're out.
But getting the message out is a bit harder this year because funding cuts mean less marketing and outreach.
So this is going to be a challenging sign-up period.
Challenging, but Kind says just as important as ever.
When people are uninsured, if they do get hurt or injured, usually they face personal bankruptcy or a life of financial ruin. Those costs just don't magically disappear. They get shifted onto people who do have health care insurance, driving up the cost for everyone else.
And Palmer says not only would being uninsured cause a headache at tax time when the penalty shows up, but it's also just too big of a risk.
And if something happens, not your fault, you get sick, whatever, that's going to be really hard on them.
In La Crosse, Madeline O'Neill, News 8.
Healthcare premiums have gone up this year, but tax credits, which are available for most people using the marketplace, will go up as well to offset the added cost.
But for help on selecting a healthcare plan, you can always contact Workforce Connections at 608-790-8136 or go to their website at workforceconnections.org.